Hey everybody, welcome to Regulatory Joe. I'm Joe Boyle, president of ClearFile, and today we're getting into what ICHRA changes for health plans with Lindsey Miller, director of market strategy and product marketing at Softheon. Lindsey, thanks for joining us today. Before we get into all things ICHRA, tell us a little bit about yourself and about Softheon.
Yeah, thanks so much for having me today. Hi, I'm Lindsey. As Joe said, I'm the director of market strategy and product marketing here at Softheon. I have been in the healthcare space for almost 20 years now in various forms and fashions. I've been on the provider side, I've been on the insurance side, I've been now on the tech side. So Softheon is a SaaS platform for billing, enrollment, reconciliation for health plans. And so we really help health plans primarily in the individual market, but also small group, Medicare Advantage, and other lines of business to do their billing, enrollment, and reconciliation. And then we also have a sister company, Well, which has a platform supporting brokers and agencies with shopping, quoting, and enrolling members as well.
That's fantastic too. And I know just Softheon being a lead organization in the traditional ACA marketplace, trailing over into ICHRA, leading into plan year 2027, and the addition of Well really is a foundation of the infrastructure of serving our members and their medical needs. Thank you for being here today. And I think we're going to be touching on all things that you just spoke about, including enrollment and billing and those functional activities that really need to happen upon any enrollment for any insurance product, specifically ICHRA for today. I guess just to dive right into it for all of our new listeners out there, if you could just give us a little bit of insight as to what ICHRA is and a quick overview of, I guess, the concept, the history, and what the buzz is all about for carriers this year.
Yeah, so I think just to kind of level set for everyone as to what ICHRA is, I'm sure most of your listeners are aware. ICHRA is a way for employers to support their employee benefits through a defined contribution model instead of a defined benefit. This is really being driven by cost predictability in the market. As we've seen group rates go up, sometimes double-digit percentages year over year, employers are looking for ways to continue to offer benefits to their employees with a little bit more of that cost containment. And additionally, so this puts the employee in the driver's seat for selecting their coverage, and which works for their family. So opposed to an employer selecting, 2 or 3 plans that may work for the vast majority of people, it's now putting the employee in the driver's seat to select from lots of plans, which is kind of a mixed bag. There's pros and cons to that. And I'm going to actually borrow an analogy that I just heard about ICHRA. I heard it from Gabe Isaacson at Integrity. He said group coverage is like your employer giving you a hamburger and saying, this is what's for lunch. ICHRA is like your employer giving you an envelope of money and showing you where the cafeteria is. So it's really up to you to figure out what's for lunch. And like I said, there are pros, but there's also a lot of things that health plans, employers, and employees need to think about.
I love that analogy too. And it's always good. And when we talk about health literacy and introducing any product, it's always good to simplify it. What that tells me is it reinforces the power of choice and consumer choice in the marketplace. When we look at why attention has been turned so quickly to ICHRA from a ClearFile perspective, where we sit and where I sit, it was the elimination of subsidy eligibility, right? So there's still a lot that's up in the air today. And carriers, I thought, essentially, as opposed to double downing on the marketplace this year, would be rescinding from the marketplace. What's actually happening from our filing perspective is as we trudge forward through the individual market filing submissions, we are seeing a greater volume of ICHRA plans that are being offered carriers of all sizes in both provider plans, regional plans, or even national plans. The change of federal policy really allowed, I guess you could say, a higher volume from where we sit. So what are some of the other benefits, I guess you could say, other than consumer choice that a carrier would essentially benefit from for this year in plan year 27?
I think, it expands the individual business. I think a lot of health plans are intimidated in some ways by ICHRA, and I've heard this from a lot of the different folks that I've spoken with. They're worried about cannibalizing their group product. And I think that we need to shift that mindset away from cannibalization and thinking about how can we support these members through their entire life cycle. So making sure that they're still getting benefits in some way. And especially if they're having a great experience with a specific health plan, like how can you support them through those stages? And, ICHRA is portable. So if a member is having a really great experience with health plan X, they could continue their coverage with that health plan, at their next employer, assuming that they also offer an ICHRA. Or if they're self-employed or, even going on to Medicare, ICHRA dollars can be used for Medicare as well. So I think health plans need to think about that holistic individual strategy and how they can help members through that entire life cycle.
I love how you said that. That's so valuable too, because offering it to offer it's one thing, but then as long as we're educating the members on how to actually utilize it, that's going to be where the value add comes in. And thinking about like putting myself in the position of an issuer and stepping back, generally speaking, every year when you offer products towards enrollment, it's a rush, right? It's easy to get distracted and not truly step back and think of a long-term strategy. For example, we know large carriers such as Aetna exited the marketplace for the second time in the individual space, which led, to your point, to a lot of plan mapping from carriers to like plans. So those members had to find a home, right? So in order to retain them, you spoke a lot about member retention. So even if a member is not eligible for an ACA plan or based on their FPL schedule, where can that carrier fit that member in and keep them in that book of business? You hit the nail on the head, and I hope for all the carriers listening out there, you're seeing not just the benefit for the member themselves from affordability, total cost of care, or other, but the other benefits for the carrier, right? So in terms of defensive submissions, defensive enrollment, and billing. We talked about a lot of positives, right? So ICHRA, it is a new product. It's attractive to members. It's favorable to plans. But in your experience, what are some of the issues that you've run into in terms of, have there been carriers that have implemented ICHRA that it hasn't been successful? If so, why? Or why do you think some people haven't implemented this product or really harnessed it to date?
I think one of the big challenges right now is that probably almost all health plans have ICHRA enrollments right now. They may not know who they are. And so understanding the data, so streamlining that enrollment pathway for ICHRA members is going to be really important, because once you understand who those members are, then you as the health plan can continue to design products that are going to better serve those members. So right now you've got ICHRA members potentially coming in off exchange, on exchange, and it's not really one market. So it's hard to quantify. It's hard to understand who they are. It's hard to understand like what contribution models are being used, how much is being contributed from the employer versus the employee having to offset, a portion of the premiums. It's hard to have a really defined strategy until you understand who the members are and how they're utilizing. So I think that's a big challenge right now. And there's no standardization in ICHRA right now. So there is no one data model that everybody's using. I think the key elements that health plans should be working to capture is contribution amount and employer at the bare minimum, so they can begin to understand who these people are, how they're utilizing care, and then, like I said, design better products in the future.
I love how you put an emphasis on the distribution channels of how members can enroll and where throughout the year. Love that concept, but then that takes a lot of work for the carrier. So whether you have dedicated resources or IT folks, or even if it's claim analytics for your individual market members to understand, does it make sense actuarially to offer certain types of plan designs in these markets? That is interesting. And that's probably a perfect segue. We've just built the operational foundation of ICHRA for a health plan and introducing it to the market, moving into or shifting into what health plans actually need to have in place operationally as ICHRA enrollment grows. So what's some advice, for that readiness? Is this something really internally that a health plan can build the capabilities, or is it more of finding like a sound, trusted partner to help navigate the ICHRA community?
I think, each health plan is going to need to define the strategy that works best for them. But I really see this as an ecosystem, and it's one that could be partnerships, and some of it could be built internally. But there are like 4 main parts that I see to this ecosystem. And that's the employer. So having the support for the employer to set up the ICHRA, from contribution strategy, defining classes, everything that goes with it, and having a human in the loop to help them go through that process, but also having the technology to help the employer set up the ICHRA, along with the setting up the HRA. Again, you're going to need to partner with somebody who can manage the bank accounts associated. The employee is the next piece. You need a digital shopping experience that is easy to navigate, that the employee can take the world of options that you have now on an individual market and distill that down into a few choices that really make sense for that individual and their family, along with a broker to educate, advocate, and navigate all of the choice. Then you've got the health plan, which is where you need a technology to help streamline those enrollments. There are a number of different ICHRA vendors out there. And for a health plan to set up an API or, direct connection with each one, that's a lot of overhead and management for the health plan. So if there's a streamlined pathway that could be leveraged, and Softheon does offer a product to help with that, where all of them come into one central point and that enrollment is bundled and passed along to the health plan as one enrollment based on the line of business. The fourth part of the ecosystem is the broker, because that's your distribution network and your distribution channel to help the employees and the employers figure out how to support the employee coverage needs.
I love that. And those are 4 core pillars. I mean, that essentially you've harnessed in terms of that complex workflow. So we talk about operations, and when we think about the administration of the ICHRA product itself, beyond enrollment, where do health plans start feeling more administrative complexity with ICHRA? So I know we talked a lot about enrollment, but whether it's payment handling or ongoing support, do we treat the member experience any differently than your traditional ACA member?
I'll talk generally and then I'll get into more detail. I think for the health plan today, because it's hard to identify who those ICHRA members are, the experience isn't different from member handling. Now, there is confusion around invoices, because if there's an auto draft set up or an HRA that the employer is managing, then an employee gets an invoice monthly, they're going to be really confused about, wait, I thought I already set this up. I thought it was already paid for. So being able to leverage a solution that's going to suppress those member invoices, that's an automatic thing for individual coverage. Being able to streamline communications, because you don't want to confuse the member around, different communications that they might be getting from like their ICHRA admin or from their HR department. And now you're also getting it from the health plan, and there may be conflicting information. So being able to streamline those and making sure that the communications are appropriate instead of just doing it the same way that you would do for any individual is going to be really helpful. I think the other thing, depending on the ICHRA admin and the HRA vendor that is being leveraged, there are different methodologies to how those payments are managed. So I've seen kind of more of a sponsor model where there's a collective payment for all the employees tied to a specific health plan. It could be 10, it could be 100, whatever it might be. But now the health plan's getting this lump payment, and that has to be split out among the individuals. So there's a need for additional reconciliation to make sure that those are appropriately applied. There's also the individual. One HRA payment is being made per individual. So there's that individual tieback, but that's a lot of drafts that need to be set up and maintained. Being able to support those models and do that additional reconciliation is going to be really helpful. Softheon, as part of the ICHRA Connector product, does offer support for both of those models and does that reconciliation as well. I know there are other tools out there that can help and support also, but it's, again, finding those right partnerships and those right vendors that can help the health plan.
I think from an administrative standpoint, having those business policies, processes, and procedures are critical, right? Like any health plan subject to audit, whether it's by CMS or state's divisions of insurance. So having that codified workflow is very important. And I think, in order for health plans to drive this well, it's an incredibly complex process with multi-layers that could involve a little bit of risk. So when we talk about where the complexity builds, I have to assume there's probably fragmentation across other platforms, carriers, reimbursements, tools. Are there any other focus areas where fragmentation does show up or where there's other confusion for breakdowns? Because when we talk about technology, so Softheon, you can have your technology, but from a coordination perspective, when you typically engage with a carrier, is it more of standing up a program or running an implementation over the course of many weeks where Softheon's really driving forward and building that infrastructure for a health plan? Or is that really driven in terms of the health plan using your systems independently, more of a BPO model per se?
So Softheon does have that implementation process where we're walking through, making sure everything's set up right, making sure everything's configured the way the health plan wants it. There's a lot of flexibility in the Softheon tools. So there is a period of time where there's kind of a hand holding to make sure that all those configurations are done correctly and appropriately. After that, the health plan is able to manage a lot of things on their own. And Softheon's still there to help. I think, as you were saying with the fragmentation, there is still that fragmentation. But I know some health plans have different vendors for those different pieces. And so sometimes things can get a little bit messy. I think, like I said, member communications can get messy. And especially with ICHRA, people are potentially getting confused. Going back to Medicare, actually, there was a recent announcement that Medicare Part D communications, if you have an ICHRA, before it was on the employer or the ICHRA admin to say, this is not credible coverage, even if the employee goes out and buys credible Part D coverage with the ICHRA, now that communication comes from the health plan so that there's reduced confusion with the employee. As regulations get better defined, hopefully we'll see more of that streamlined communication because that's a real point where there is friction.
And actually, let me ask you a question on that topic. Do you foresee, just in a general concept, more rules and regulations being created around ICHRA over time? I'd be curious to see over the next, let's just say, 3 to 5 years, what types of new rules may be coming. But any thoughts there?
Yeah. Well, we're seeing a lot of states, beginning to have the conversation around ICHRA. And so we've seen legislation proposed in a couple of states where they're designing tax advantages for the employer. I think one thing that I would really like to see, though, is making sure that the contribution is tied to that tax advantage so that the states aren't inadvertently creating tax loopholes that could be taken advantage of. And I think we will see something from the federal government. I know we've been saying that, I feel like, for 2 years now, that something will come out. I think we will see more regulation around it just because there is so much more interest and the conversations are getting louder around ICHRA. So I think that the state and federal governments will react to that.
Well, I think that's a good message also for all the carriers listening because, implementing the product's one, but then having a good line of sight to your regulators on a federal and state level would also be key if you're playing in the ICHRA space. When we think about readiness in terms of, I guess, looking towards your traditional November 1st enrollment or into plan year 2028, if you had a metaphorical crystal ball in your hands and if you could see the future, so in addition to planning and standard operating procedures and member readiness, elimination of confusion, what do you think health plans will need to get better at next?
That's a good one. I think I would go back to the data, being able to really have a good data strategy and data analytics. And I know a lot of health plans have invested in this. I think just making sure you can understand who your members are and how they're utilizing care is going to set you apart from the others because you can design products from a cost benefit perspective that are going to support operations as well as the individuals and keeping those members with the specific health plan. Another thing that would help health plans as they're looking to the future is thinking about these ICHRA enrollments and how group coverage is applied. So making it feel a little bit more like group coverage is going to increase that satisfaction. And as we're seeing, people who are enrolled within ICHRA tend to have higher satisfaction anyway. So if we can continue to make it feel a little bit more like group coverage through the communications, through member services, et cetera, that's going to help the health plan. It's going to help the employee. And I think another place where some health plans were burned in the past was looking at how individual coverage, kind of like group coverage, but now you have individuals coming from group coverage into individual coverage, and they're going to behave differently. So from an actuarial standpoint, you need to look at them a little bit differently so that you're designing the products and supporting them in a way that's going to make sense operationally.
There's definitely going to be more to come, especially with all the activity in the marketplace this year. I'm thrilled to see where ICHRA is going through the end of 2026. And it's just remarkable to see all the work Softheon is doing in the marketplace and also binding these complex activities together for the carriers. It's been a challenging year in healthcare. So I do think affordability of coverage is huge, and ICHRA is serving that purpose. So I do think that we'll see probably healthy competition between traditional ACA and ICHRA. But, as we kind of wind down, where can we find you? Tell us a little bit about where we can get in touch with you and where folks can contact Softheon.
Yeah, we have all the standard social media platforms for Softheon and Well. I think we're most active on LinkedIn. I am also pretty active on LinkedIn talking about ICHRA, so you can follow me there. I know Lindsey Miller is a common name, but if you tie Softheon and Lindsey Miller together, you should be able to find me there.
Well, it's been great having you on the show, Lindsey. Thank you so much for joining us. For all the listeners out there, give us a like, give us a share, and we'll see you all next time.